All right, let's jump right in. Hey, everybody. Welcome to the show today. And today we're going to be talking about teeth, our lovely piece of our body that is helpful for so many things that we often neglect and often presents a wide array of issues as we transition away from the conventional, standardized way that we've been prescribed to live. And then, of course, we are offered quote unquote solutions by this standardized society that end up creating greater and greater issues and creating worse and worse problems. So this is something that is near and dear to my heart, and I know is near and dear to Noah's as well. And I'm so grateful to have Noah join me again on this show to share her gnosis, her wisdom, what she's learned along the way, both from personal experience and through her research. So we're going to dive into it and just go over the initial presentation, and then hopefully we'll have ample time for questions towards the end, because I know this is a topic that is commonly asked about and people often have issues with. So it should be a really good discussion today. So just thanks for being here, Noah. I really appreciate you joining me today, and let's jump right in.
Yeah. Hello. Can you hear me okay? Can you see me? Is
Yeah.
my video on?
Yep. Both.
Okay. Okay, great. Yeah, I am so grateful to bring this topic to the light. Justin and I have been discussing this for the last few weeks. When is the right timing to do so? So today is the timing for this. Yeah, and I have tremendous experience. I want to say unfortunately, because it hasn't really been the most fun thing to have experience in. However, I see that as it's just part of what I'm here to share and to offer. And I'll dive into it a little bit later, just regarding recent experience that I had, but I'll start by saying that from a very young age, I started going to the dentist, and I see it happening these days just as much. Even friends that have really young children that have teeth issues at the age of 2 and 3. I wasn't that young. I remember probably around 6 or 7 I was when I started going to the dentist, which is still very young. But these days, I'm quite shocked to see that kids at the age of 2 and 3 having teeth issues. Which, it's the genetics are just getting weaker and weaker as the generations progress. So I'm not surprised at the same time. But it's definitely time to remember that the teeth are part of the body. It's been this, and I even wrote it in the post, this odd separation that has occurred, that there's the body, right? And we've got all kind of doctors and specialists for the body and the different parts of the body and the different systems. And then we have dentistry as a separate thing in some way, shape, or form, which just to begin with, there's something faulty and false right there. And that conventional dentistry, when I started going to the dentist at the age of 6 or 7, that was not something that was common. Like, to find a dentist that was holistic in their view, that actually understood that the teeth are not this separate thing, but it's connected to everything in the body. And the underlying cause, and this is what I really want to dive into, the underlying cause of teeth issues, to whatever extent, and gums and teeth, are directly connected to the same root cause that causes every single other issue that we are familiar with in the body. Any kind of dis-ease, any kind of deterioration, any kind of inflammation, any kind of infection, any kind of issue that is less than perfect health, and even alignment of the teeth, we can trace it back to the same exact root cause. It really is that simple. Lymphatic stagnation with elimination channels that are not working properly to remove the waste out of the body. What happens then is that waste creates an acidic environment. There's a buildup of mucus from the different foods that most humans consume that are mucus forming foods that produce more and more mucus as the body tries to protect itself. Then the elimination channels are not open enough, and so the buildup of waste continues to build up as the years go by. And the lymphatic stagnation continues to increase the level of stagnation. So when that occurs, there's an acidic environment in the body, and acids are the ones that basically destroy cells and tissue and the integrity and the function, the divine function of our cellular structure. Well, guess what teeth and gums are made of? Cells and tissues, blood and lymph. Everything in the body is connected to the blood circulation and lymph vessels there's more lymph vessels in the body than blood vessels. And so when that begins to build up and there's an existing weaknesses in the teeth and in the gums because of genetic inheritance, then the particular individual, like myself, is going to be susceptible to teeth deterioration and decay. But it's not only the teeth or only the mouth or only the oral cavity that we need to look at and address. So when we go to the dentist, a conventional dentist, that's what they do. Just like when you go to a conventional doctor and they find that you have a growth or something abnormal on your thyroid or any part of your body, the route would be either medication or to cut it out, or both. And dentists are no different. I call them butchers because we get butchered by conventional medicine. Organs get taken out, teeth get taken out, all kind of very damaging procedures that are done in our teeth that damage the integrity of the tooth, which then after a few years is going to have different implications and different things that are going to be affected because of that. Mainly root canals, which I'm going to go into. So when we go to a conventional dentist, like I went to at a young age, they don't know anything about, well, tooth number 18 is actually connected to the small intestines, or tooth 17 is connected to the heart. Every single tooth through the meridian system is connected to a different part of the body, either organ or a gland or both. And what happens is that, thank you, Justin, for sharing that chart. What happens is that when there's a decay in a tooth or something is happening in the mouth or in the teeth, the first thing to check is what is connected, what organ, what part, what system of the body is connected to that particular tooth. And most of the time, the decay in the tooth is just showing us the toxicity in that part of the body. Now, in the majority of cases, because the mouth is also part of the GI tract, it's the first opening. So anything going on in the mouth is a direct reflection of the GI tract. The more toxic the GI tract is, the more susceptible the mouth is going to be to decay. The tongue is a reflection of the stomach and the GI tract, and the teeth and the mouth in general is part of the GI tract. So that's like number one for any dentist to actually realize and address when they see a patient that has a lot going on in their mouth. There's just like an ongoing decay, no matter, and this is my case, no matter how, and I speak to people and I hear people that are very frustrated. I brush, I do all the things, I oil pull, I do this, I do that, but every time I go to the dentist, there's more cavities, and there's more this, and there's more that, because the root cause has never been addressed. And what dentists go after, just like with regular doctors, they go after the germs, they go after the viruses, they go after the bacteria. And same thing applies to dentistry. They go after the bacteria, that thinking that, oh, the bacteria is the cause, or it's the enemy, and that's what we need to destroy because it's the bacteria that is destroying the mouth. It's the bacteria that is destroying the teeth. Now, there's truth to that. However, though, it's not the whole truth, the full truth, and nothing but the truth. It still doesn't address, well, why there's such an overload of bacteria in someone's mouth. And that's when we got to look at, well, the saliva is acidic, and saliva needs to be a pH of alkaline pH. And bacteria is going to proliferate in an acidic environment. So this is like the perfect setup for teeth decay, is an acidic saliva, an acidic environment in the mouth. Plus, there's already lymphatic stagnation in the head area, which obviously affects the mouth and the gums. So there's not enough blood circulation. There's not enough oxygen supply, which that's what helps to heal and regenerate any kind of issue. The elimination channels are not open, so there's a waste buildup. As I explained earlier, there's an acidic environment in the body in general, but then in particular in the mouth. And so the bacteria can flourish. And yes, and then we see decay. But it's never the bacteria just to go after, because then people employ all kind of topical methods, right? We have the oil pulling and the mouthwash and all those things that, if are used too much and out of balance, actually have some harming effects as well. But then people are under the impression that I need to take care of the bacteria. No, we need to take care of why there's a proliferation of bacteria in the mouth in the first place. So just like so many other issues in the body, the one of the first places to go is the GI tract, but especially when it's related to the teeth. So to clean up the GI tract is the first thing in order. And then we got to look at particular teeth that have the issues in the body, in the mouth, and which organs, which glands they're connected to the body. And I've seen it time and time again, Justin. It is completely undeniable. Of even clients that, I had one client in particular, and she had, they found growth on her parathyroid. And she embarked on a detoxification journey, and she was a superstar, like doing the fruits and several juice feasts of different lengths. And she was very much on a path to healing. She wanted to move away from conventional medicine. She didn't want any, because of course the doctor said we need to operate and take the growth out. And she said, no, thank you. I'm going to take care of it myself. And she was doing all the things, and there was the growth remained the same. It didn't get larger. But then in one session, I asked her, like, what, do you have any root canals? And she had 2 or 3 at that point. And I asked her which teeth. And one of the tooth that she had root canal on, well, guess what? It's connected to the thyroid. And in my own experience, I can tell you that I had 9 root canals that I had throughout my life. That the first one, I was very, very young. I don't even remember. And my mouth got butchered by many different dentists that now I look back and, yeah, it's frustrating and I can get angry. I didn't know what I know now. So I just went to dentist and I nodded my head and I was like, sure, yeah, do a root canal or pull this tooth out or whatnot. But anyhow, I had 9. I had 9 root canals, and it's not until I went to see a holistic dentist for the first time, like truly holistic, here in San Diego, actually. And that was back in 2016. And he did some testing just energetically on the meridians. And he said, Noa, all those root canals, like, yes, you've got different stuff going on in your mouth and different issues, but those root canals are definitely weakening your system overall. And he said, my recommendation is that you take all those teeth out. And of course, I was mortified in that particular moment. Just the thought of pulling out 9 teeth felt so barbaric and insane. But I also knew that there was truth there. And so I gave myself a couple of days to feel into it. And then I went back and I said, listen, I just can't take 9 teeth like all at once. I just can't bear that thought. So just tell me which are the worst, and I did have 3 that were in really bad shape and infected. And so I just decided to go ahead and take out those 3. And I remember the moment that, now I was slightly sedated, with the laughing gas, but I was still somewhat awake. And I remember, though, the moment that he pulled those teeth out, I felt this sense of relief. It's as if my body was exhaling in relief. I really felt that energetically. And throughout the years since 2016 until now, I've been taking out the rest. And just recently, I took the last 3. So I had a big surgery taking those 3, and I did put some implants in, zirconia implants. But every time, and especially the one, so I had those 3 root canals left out of the 9, and I knew that was inhibiting the levels of health that I can experience, because I've been on this journey for many years, and especially the recent years with more fasting and the juicing and the things that we've talked about already. And I could feel it. I could just feel it. I could feel my body, and I could even see, okay, which teeth connected to, it was the small intestines and the stomach, and just areas that I've had issues with throughout my life. And I just knew, like, those teeth, that this is the time for me to reach that next level of my health. And I can tell you now, and it's only been, so the procedure was in February, so it's been not that long, 4 months. And shortly after, because it took a few weeks to just recover from the procedure itself, but even as I was still in pain and discomfort from the procedure, I could already feel the energetic shift and change in my body, having those root canals out. And now, a few months later, it's just undeniable of the difference that I feel having those teeth out. Because when it comes to root canals, those are dead teeth. And going back to what I said at the beginning, that it's so odd that dentistry has been separated from medicine. It's just this whole other body of work. It's so strange that a doctor, like if you had a dead finger for whatever reason, or a dead arm, no doctor would ever suggest just keep it. Just live your life with a dead hand connected to your arm. But dentists do it all the time with root canals. I had 9. There's some people that have more than 9 even. And those are dead organs, basically, because each tooth is a living entity. It's not this like dry bone or hard material. It's a living being that is, as I said, connected to different organs in the body. It's connected to the nerves. And hey, it's in the upstairs department connected to the brain directly. And dentists just nonchalantly allow or believe that dead teeth in the mouth is no big deal at all. And it is. It's a huge deal. There's no blood supply to the tooth. It starts to rotten. And then, of course, it's an invitation. It becomes a cesspool that can host different strands of bacteria and fungi and even parasites. And it's a big deal. So that might not be the case for many people, and bless you, I'm happy for you if you don't have any root canals in your mouth. And I also speak to people that ask, a doctor or dentist told me either root canal or to extract the tooth. What do I do? And in my humble perspective, and there is some technology out there now that can perform root canals in a much better way, in a more holistic way that doesn't compromise the integrity of the tooth that much. However, though, a root canal is a root canal, and the tooth is going to be a dead tooth eventually. So it might last a little bit longer. It might not give you issues a little bit longer, but rest assured that at some point it's going to catch up because it's a dead tooth. So my suggestion to people is usually, it's a case by case for sure, but in general, I say it's better to take the tooth out than to do a root canal. And then figure out what you want to do with a tooth, depending also where it is, if it's a back tooth, a front tooth, and then, the replacement is another issue all on itself, because having missing teeth obviously affects the whole mouth, the whole jaw, the structure of the jaw, which affects even the alignment of the spine and the hips. So everything is connected. And that's why teeth are not just, just for dentistry. No, it's connected to everything else in the body. And we really need to be wise and aware of how intimately teeth are connected to everything else, physically, emotionally, and energetically. And so for many people, just like myself, it's facing the consequences of past procedures. Okay, my mouth has been butchered. And at this point, it's there's some things that I believe that the body can heal and regenerate itself no matter what. That is truly my foundation. And when it comes to the teeth, there's some things that are irreversible in the sense of if you have a root canal or 9 of them, that tooth is not going to just come back to being a live tooth. And I'm not saying that there's no possibility for that, but it definitely requires years of regeneration that will require like deep levels of fasting and just a whole nother level. So I don't know, because I haven't done it myself. I did decide to pull those teeth out. And that's the case for many people, that it's the past procedures that they've done in their mouth that now is the time to consider, okay, what do I do with the situation that I have now? And then for people that are blessed with more strong genetics when it comes to the oral cavity and teeth and gums, then it's crucial to understand, like if you do have minor teeth issues, and I know you want to speak about this today, Justin, like on detox when people start having teeth issues and what to do about that. So we'll get to that. But just to have the awareness, like when you do have anything show up in your mouth, if it will happen, even if it's a cavity, and cavities are definitely, you can heal cavities with no fillings, no doubt. That is just an absolute no doubt. So even holistic dentists, don't let any dentist tell you that you cannot heal a cavity. You got to have a filling. Yes, we want to look at how deep the cavity is, because if it's really, really close to the root, we just need to evaluate. However, though, for those that are inclined and aspire to heal cavities, also know that it is going to ask you to change your lifestyle big time. And we are looking, yes, at the food, and as I mentioned earlier, we got to change the environment and the chemistry in the body, and actually start creating more of an alkaline environment in the mouth, utilizing things like fasting, like juicing, cleaning the GI tract, using herbs, and then oral applications to help with the regeneration of teeth. Like, right these days, there are actually some amazing things out there that can help heal cavities. Not that you need all those products, but there's some things that can help. And I myself use some things to help strengthen the gums, and I see the difference. So it needs to be kind of like a double approach of the inner terrain always. That's the first thing in order, the inner terrain. Keep checking the pH in your mouth and see what's going on with the saliva, and then doing whatever it is that you can do holistically in the mouth itself. And we can talk about some of those things. So I just wanted to start with that, and just to lay the foundation of understanding the root cause of teeth issues, and even in gums as well. Receding gums, bleeding gums, weak gums, anything to do with anything in the body. This is the foundation. Blood, lymph, nerves. Everything is built out of cells and tissues, and the teeth and the gums are no different. And even holistic dentists, because I've had my fair share of talking to different dentists and doing my research, and they're definitely a step up from conventional dentistry. And there are some holistic dentists out there that I really bow to, because they are revolutionizing the dentistry industry. And many dentists actually are very courageous, because they're putting their license on the line. And I've heard stories from dentists, that the license have been revoked because they speak against root canals. They, just like in medicine, doctors that are brave enough to step forward and speak about certain things. Same thing with dentists. So there are dentists out there that are that much more advanced in their thinking and their awareness, and the material that they use in their patients' mouths, the procedures that they recommend and they do. There's some holistic dentists that do not even do root canals. They do not do it. They just won't do certain procedures. Just like, a detox specialist will never tell you, like, take a drug or whatever, something that they know that will eventually harm you. And but there still seems to be somewhat of a missing link for many holistic dentists, even those with very advanced thinking and advanced awareness, not having the full picture of what I'm speaking about here. The whole connection to the lymphatic system, and your elimination channels are not open enough to remove the waste in your body. And that's why there's a buildup of acidity that is starting to affect your teeth. So there's more and more awareness starting to build up, which I'm very grateful for. And yeah, many holistic dentists that do have the awareness of the food that you eat and how that affects your body and how that affects your teeth. But I have not yet to find a dentist that is, fully on board with understanding the fruits and the magic of the fruits and the detoxification power of the fruits, and even how fruits clean the mouth, believe it or not. They don't only create an alkaline environment in the body, but they also, it's the only food that we can consume that doesn't leave an acidic residue or a buildup of film or filth on the teeth. So that's just another evidence as to why fruit would be the perfect food for the human organism. So yeah, I feel that there's definitely a lot of advancement that is occurring right now in the dentistry industry, and more dentists are becoming more and more aware of the tight connection between food and the environment of the mouth, plus even talking about fasting as a way to heal, as a way to heal teeth. So I'm grateful for that. And more of these conversations definitely can help to increase the awareness, because as people, if you do need to go to the dentist, then it's important that you've got the right information to ask the right questions. So let's say you do find a holistic dentist. When you are equipped with more knowledge, you can actually be aware of certain things and ask questions and know, well, is this the clinic for me? Is this the dentist for me? And that's what I would love to offer today as well, is for people to know, like, ask A, B, and C, even in terms of if you need to have a particular procedure. Just ask the dentist, what kind of protocol do you use? And there are some different protocols that can help tremendously with the healing process. If you have a big procedure, if you do need to have an extraction, for example, or you want to put an implant or whatnot, what kind of materials, what kind of protocols. And yeah, so I'll pause here right now and see what you've got to say, Justin, or if there are any questions, and we can just go from there.
Yeah, thank you for that. That was beautifully said, and it is certainly a detriment, this sort of compartmentalized approach that mainstream society has with all forms of everything, really, but certainly when it pertains to physical health. And the dentistry is no different in that aspect of training people to only view the mouth and the teeth as a separate part, and we only address the things on the surface level there without taking a holistic look at the rest of everything. So this is, akin to this left brain approach of always, which, there's value in it at times to have that sort of nuanced, specific analytical portion of looking at something. But if we're negating the right brain, the heart-led, holistic approach of seeing the interconnectedness of all things, then we're always going to be missing that link back to the root, because it's all connected. So it's important that we recognize that. And also the truth is simple. The truth is always simple. However, the lie can get very complex. And because, as Noah has mentioned, we have been living this lie generationally, and we've been making these choices out of alignment with our true, authentic nature, then we have wound ourselves down these weaving dead ends, various directions, and the road back can be complicated at times. The solution is simple. What we get to is simple. But the path and how we've wound ourselves in these spaces, and what our parents have done, and what our grandparents have done, and what's gotten us to this space, can introduce some nuances that are important to sort of discuss and strategize and find the best ways to go about it. So yeah, that's why this is such a great conversation to have. If we have that base understanding of what is the foundational, what is our species specific diet, where did we stray from that, and how do we get back to this? And how can we unravel this complex situation that we found ourselves in? So yeah, I thought that was a good point to add. And then, concerning the fruit, and, some people, I'd love for you to speak on this, but some people do have concerns that certain fruits will, the sugar will deteriorate, or the acids in particular fruits or whatever can deteriorate teeth. And, this is a misconception. The fruit can, because it is so cleansing and it's so detox stimulating, it can lead to toxins coming out of our body, which can lead to the decay of our teeth or other areas. And yes, we'll definitely go into that. But just to give an example, one of my foundational people who got me into this way of being was Josh X. And he spoke about how he went for months without doing any tooth care whatsoever. And he was only consuming orange juice. And he would even swish it around in his mouth periodically, just to prove to himself, can this cause damage to my teeth? And he said no issues came about his teeth. I mean, granted, he had been spending many years cleaning up his body, getting into this state of optimum health, transitioning away from the processed foods. This has been something he's done for most of his life. So he's coming at it from a very good foundation. But just to prove that the orange juice, even though it is slightly acidic, even though it has lots of sugar in it, to sort of disprove these lies that we've been told that it is the fruit, or it's the acids in the fruit or whatever that can cause problems in the mouth. Now, again, I'd love to hear Noah talk about that, because it's not that it's an end all be all. When we're coming from a toxified body, they can stimulate an effect that will give some damage to the teeth. So we do have to go about this strategically, and it's not something that we might be able to do that same experiment without having different results. But just to say that the underlying root cause of those issues are not directly from the fruit, though they can lead to those issues. So yeah, it's a nuanced conversation to get into, but I'd love to go over that as well. And then whatever direction you want to take us.
Yeah, awesome. Let's go in that direction for sure. Because we touched on it yesterday as well when we spoke about this. So first off, the whole notion of the sugar in the fruit destroys the teeth and the acids in the fruit, that's bogus. It's complete bogus, just like saying it's the bacteria's fault. That's why your teeth are decaying. So as I explained, there's truth in that. There's a difference between the whole truth, the nothing but the truth, and there's a speck of truth in something. So we want to make a distinction there. And there's truth in the fact that, yes, there's fructose and glucose, mainly fructose in fruits. I don't even like to say sugar because people have an idea. Sugar in fruits is not the same as eating candy. The candy is going to destroy the teeth. Oh, again, not because of the sugar, but because of the acidic environment that kind of crap creates in the body and in the mouth. And that's what creates the proliferation of bacteria. Okay, so it's not even the candy, but it's the effects of that crap. So going back to the fruit, it's not the sugar, it's not the acidity, it's the fault, right? However, though, just like you said, Justin, when somebody begins to consume only fruits for the purpose of detoxification, they make a choice that they say, I want a clean house, or going on a juice feast, right? And there hasn't been a transition, though. This is where it's case by case. So if somebody already has an existing weaknesses in their mouth, in their teeth, and they go from junk eating, or even if it's not junk, don't even think that it's just McDonald's and KFC. Even if you're eating mucus, it can be vegan, all raw even, But if it's mucus forming foods, like heavy on the nuts, heavy on the seeds, heavy on the oils, and cooked food is extremely acidic and dehydrating. So even if you're eating vegan, that, yes, is definitely better than eating meat and dairy that is extremely constipating and mucus forming. But anything that is less than, fruits and veggies and clean alkaline eating is going to create mucus in the body. And if the lymphatic system is already stagnant, as I said earlier, the elimination channels are not open enough, then this person is coming now and saying, I just want to go on all fruits. Wonderful. But then, 2 weeks into it or 2 months into it, their teeth are falling apart. And that's why many people believe, oh, it's the fruits. But just like Justin, you said, the fruits are very cleansing, and they're going to expose. So here's the thing: when we start to decleanse, whatever the route that we take, if it's all fruits, if it's all juice or partly juice, partly fruits, or fasting, and then things start to fall apart or get even worse, as it seems, or inflamed, then we tend to blame the thing that we've started. Oh, it's the fruits. They're destroying my teeth. Or the juices are just not working for me because I feel like shit. Or I can't do fasting because, my arthritis is flaring up again. So understand that when we start to cleanse like that, it's going to expose all the weaknesses in the body and everything that has been tucked in behind that veil, behind that curtain of mucus and stagnation. So it's equivalent to, let's say, if you've been shoving things in the closet for 20 years, 30 years, 40 years, as long as you've lived. And I want to give a side note here, though, that whatever the condition in your body is not like a clean slate when you were born a baby. You inherited everything from your papa and your mama, especially your mama. So if your mama had some serious issues with lymphatic stagnation, guess what? You are born here not as a clean baby. None of us were born just clean slate. So it's not just the years that you have lived shoving things into the closet, but it's like the generations before you. And then you continued with food choices because most of us did not grow up eating only fruits. So all those years is like, imagine yourself just shoving more things into the closet, into the closet, into the closet, into the closet. And then at 25 or whatever it is, maybe at 65, you decide that, let me just open up the closet and see what's there. And you open the door and it's like, well, you can't even see all the way into it. And the amount of dust and things that have been accumulated on all this stuff. But then you need to start cleaning the first layers to actually get to the back. But that's what we do when we bring in those alkalizing fruits and juices and start doing the fasting, is like opening up that closet door, basically. And things might flat out depending on how backed up it is and how much stuff there's in the closet, because you might open the door and there's going to be a flood of shit that is going to like bury you, that you have forgotten that you even put in that closet. So that is the example of what happens when we start to cleanse. And some people might experience that deterioration of teeth. It's basically all that gunk, all the stuff that you've shoved in the closet all these years that are coming out. But in this case, it's not just a closet that all the things can flow through it. We're looking at the elimination channels. That's the key. That's the key to health. Open your elimination channels and get the junk out. Then we can start regenerating. We can regenerate on existing junk. So the elimination channels are the key to this equation. We got to open the doors first before regeneration can take place. but we don't know how long it's going to take. That's why it's not like a quick fix. It's not a week or two or just doing one juice cleanse and the elimination channels are all open. And depending on the case, for some cases, it is a matter of years to really open up those elimination channels to such an extent that the body can now, really begin regenerating. So for those individuals that experience this tremendous deterioration of teeth shortly after beginning the fruits or juices, that will be one of the reasons to that experience. The transition was way too abrupt from the cooked, the mucus forming foods into the super high cleansing. It's like going from first gear to fifth gear. Think about that, in a car. It's going to get really clunky. You want to like go slowly from first to second to third to fourth to fifth. And so the gradual transition that many health coaches, like the mucus-free arena talk about is that gradual transition that can help individuals to avoid such extreme and sometimes very painful and uncomfortable breakdowns, especially when it comes to teeth. So again, it's not the fruits, it's not the juices, it's not the fructose in the fruit that is destroying your teeth. It's not the fructose in the fruit that is inviting bacteria. No, it's the acidity in your body that has been building up and the elimination channels that are not open enough. And it's going to take a little bit of time to actually change the chemistry to where the saliva in your mouth actually becomes alkaline. That can take a long time. And again, going back to the shape of the GI tract, as long as that is still toxic to some degree, it's going to affect the pH level in the mouth. We can separate the two, like, no matter how much we want and try. And so, so that's why, again, like you said, also, Justin, it's a case by case. And Josh's example, you even said it, he had a history of much cleansing before he did that experiment. So that's a huge factor to put into the equation. And for people to have the understanding and the knowledge and the awareness that you can just hear someone's story and like, oh, great, so I'll go now and just do orange juice and swish it in my mouth and see what happens. No, we want to look at what have you been doing up until this point? What's your situation? It was a great experiment on Josh's behalf just to, again, prove it's not the orange juice, right? They're considered to be the most acidic. That's nonsense. I actually do it. Actually, there's some tribes in Africa. They use kind of a citrus. I don't know if it's like the lemon and the limes that we have in California, but a kind of citrus to clean their teeth. The kind of lime that they use to clean their teeth. And in those tribes, obviously, they don't have any teeth issues because they don't consume processed food. So it's not the acidity even of the citrus itself. But I'm not going to recommend people to just go and do that because for the majority of people, it's still very acidic in the mouth. So if you introduce a more acidic fruit, then of course it's not going to go well. So in those cases, and I'm not saying for people to not go on all fruits or not do the juices, but if you going into it without a gradual transition, then you definitely know what to do in your mouth to at least keep the environment more alkaline. So you can avoid the deterioration of the teeth.
Yeah, speaking from personal experience, I definitely recommend that. I went and I've spoken about this many times, but I went very hard and fast into leaving the processed foods, the animal products, the alcohol, lots of things that were damaging my body, and straight into a juice cleanse, and then staying 100% raw for quite some time after that. And it felt great at first, and then slowly started to see some of these signs of hair loss and tooth decay and loss of strength, and all these sorts of things that, of course, were somewhat alarming, but I still had trust in the process, and I knew that my body was going through what it needed to. However, coming into some balance on the other end of it, realizing that might not be the best approach. Actually, I'd say it's not the best approach unless you really want to go through that and deal with those kind of things. I don't think it's ideal to have that experience. It is much better to go for that gradual process, working through and moving through these things, unless you have some life-threatening ailment, and then you do have to take some more extreme measures. Then you might have to go on something like a juice cleanse or a longer fast, where yes, you might experience some external appearance, loss of hair or teeth decay or something like that. But at least you're addressing the life-threatening ailment in that moment. So it is a case-by-case basis on how to approach this. But if you don't have something that is so life-threatening in that case, it is much better to take a gradual approach. And that's why I invite anyone whenever I'm doing a challenge on myself to go into a deeper level of cleansing. It's open-ended as far as however anybody wants to take it, because we have to be honest with ourselves. Okay, where am I in this process? How have I been eating? What have my patterns been? How long has it been this way? And what is the next step to let go of? So what is this gradual step? So if it's letting go of coffee, for example, that's an easy step. Is if it's letting go of foods cooked in oils, that's a step I can take. If it's letting go of cheese or animal products, that's a step that I can take, but not doing it all at once and going straight into a fruit-only juice cleanse, unless that is something that, I'm willing to embark upon, taking into account that there is some risk involved with doing it hard and fast in that way. So it's great to strategize and share and compare notes. And I know that I went through that so that I could share it with others. So you might not necessarily have to go through that same sort of effect. And of course, I came out on the other side and I'm fine and well. So you'll live through it, but it's good to perhaps go through it a little bit more comfortably, because, we're doing this in a way to, it's harder to even speak the truth about the fact that this is the way to vitality and health if we're all appearing like we're falling apart. If we're falling apart, then it's hard to say, yeah, this is the way. Fruit is our food if we're falling apart internally or externally. So it's good to have that as a consideration and just take it slow, take it as need be. So I think that's a great point to consider, and thank you for sharing all that.
Yeah. Yeah, it's great that you can speak from experience when it comes to that going from one end of the spectrum, from the first gear to the fifth gear, basically, and the consequences of that. And yeah, so it's wonderful that you have that. And like you said, you didn't die from it necessarily, but you also, and this is something I mentioned to you already, you also have very strong genes. So there's some individuals that if they were to take the same approach as you had taken, that don't have a strong genetic makeup like you do, would find themselves in a much more dire state. But yeah, again, I don't, it's all very general. These are all these topics always when it comes to health and vitality is so case by case, because it's also not just the body. Even when it comes to teeth, right? There's emotional components to that as well, energetic components. When we look at the mouth, when we look at the head, we can go into like all kind of energetic and spiritual rabbit holes when it comes to what does that represent, and the teeth themselves, which similar to bones, but just like bones, it's not a hard material. We go back to Capricorn, and the element of Capricorn, and what does that represent in someone's chart and in an individual. And usually you can see a lot of Capricorn influences in someone's chart when they have teeth issues, or 10th house or some I mean, that's a different conversation, unless somebody have more specific question about that. But it's always a case by case. It's always case by case. And what I'm sharing here today is a very general knowledge just to have regarding the root cause of teeth issues, because that is not case by case. If you have any kind of teeth issues or have had teeth issues, it's not the fruits to blame. It's not the fructose. It's not the bacteria in your mouth. It's the inner terrain. It's always like the finger back into what's going on inside of me. And what I wrote in my post too, just to consider, is that those are things, that we see run in the family, right? That's why I have genetic weaknesses when it comes to teeth on both sides, both in my mother's sides and my father's sides, tons of teeth issues. Grandparents, uncles, like everyone has teeth issues. So it's acceptable, like people just believe, well, everyone in my family has it, then of course I'll have it. And that's why Noah started to go to the dentist at the age of 7, believing it's absolutely normal. There's nothing normal about a child at the age of 2 or 3 having teeth issues. Nothing. It gets me riled up because those are just things that people have come to accept and just believe, like, this is how it is. I'm taking my child to the dentist at the age of 3. No, that's not how it's meant to be. We got to look at why our babies are being born with tumors. Like, that's not okay. That's not part of the divine design. It cannot be an acceptable thing. If we accept something, then we just give it permission to exist. So if we accept, like, dental issues are, I'm now more aware of, like, it's everywhere. Like, I see dentist clinics everywhere. It's like a thing, and we got to question that. We have to question it. We can't just accept those things as normal part of life, because we're going to continue to give it power. And we are meant to have all of our teeth intact and healthy and in great shape all the years of our lives. So the whole, it runs in the family, then everybody accepts it. Everybody just keeps providing the dentist. Here you go. And not asking the right questions. So just like any other disease that runs in the family, the question to ask is, why does it run in the family? Why does everyone have dental issues? Well, because everybody is eating the exact same food that grandma used to eat. And, and it's actually becoming worse and worse. Grandma actually used to eat much better than, 30, 40, 50, 100 years later. So, I mean, I drank soda, I ate candy. Maybe I stopped eating meat at the age of 12, but I was not like a healthy vegetarian. I ate tons of dairy, a ton of dairy, which is extremely mucus forming. I ate a lot of eggs. So, I already had those genetic weaknesses in my teeth. And then I didn't take the right steps to correct that until now that it's too kind of late. But that's something to really have at the forefront of our awareness and consciousness. Why does it run in the family? And I am going to be the one to say, and stop. I'm going to stop running with it. So if I want to or plan to bring another generation, they're not going to have teeth issues, because it stops here with me. And then I know how to also raise the next generation so they don't need to face those issues in the first place, to the best of my ability, of course, as long as I can. So the awareness around dentistry is that needs to increase and increase and increase, like I said earlier. It's not an acceptable thing that because my mom has teeth issues and my dad has teeth issues, that means that I am doomed and destined to spend many hours on the dentist chair and invest many dollars into those treatments. You know, there are many things that are so completely avoidable for people, but especially if you are in a good shape, orally speaking, and you don't have so many of those old procedures that need to be corrected, then this is the time to, like, whatever you have going on, that it might be minor, that you can reverse that you can treat that just by changing your inner terrain, changing the chemistry in your body, opening your elimination channels, and then in your mouth, put some things in place that can help with the regeneration of your teeth and your gums. Like things like receding gums, for example. The dentists tell you, you just like cavities, you can heal cavities. You can definitely reverse receding gums, 100%. Or at the very least, stop it from getting worse. And there are many different procedures that can be avoided if there's a willingness to do the work, so to speak, right? Like it does require, like fasting is such a great way to help the body regenerate, but at the right time. Just like Justin said, if you're not on your deathbed, then there's much better that you do a little bit of transition before jumping into more extensive solitude vacation or fasting. Short fasts, though, there's always things that we can implement within the transition that can help. So it's not so black and white, these things. It's not either or, fifth gear or first gear. No, we've got some gears in between and we can play with it. So there was one more thing I wanted to say, but I forgot now. So maybe it will come later.
Yeah, maybe we'll swing back to that. Yeah, I'd love to sort of just go into practical solutions, because I know that will be a question for people. And, again, want to stress the importance of the main focus, and the fact that I'm sort of going over this quickly does not mean that this is the priority number one. Just, we've talked about this a lot, and we've had many discussions concerning the holistic health, the bodily health, the foundation, the terrain, but that's got to be the focus. So wherever you are in your space, finding ways to step further and further into a space of alignment so that my body is connected in a way to where I'm not contributing to the root cause of this issue when I'm addressing my teeth and oral health. So things like fasting and cleansing the body, moving towards more fruit and less processed foods, and cutting out animal products and things of that nature. Hydration is very, very important. Fruit does that, but supplementing hydration if we're eating salt or cooked foods or things like that are very important to address as well. But I'm not going to spend a lot of time on that, because I want to stay on the dental, the mouth area, and maybe some practical solutions there. So yeah, if we could go over just a few things, a few protocols that might help people mitigate some issues as they're going through some sort of uncomfortable things that are coming up. Perhaps they did detox too quickly and things are expressing in the mouth. How can we mitigate this so to avoid those, to reduce them, and eventually heal back from them, to support from the other end while we're supporting our body, cleansing it from the inside out. Yeah, I want to go over that, and I'll just mention a protocol that I've been implementing recently that for about 4 or 5 months now. Yeah, I think it's been about that long, since January or February or so. And this is something that Lila introduced, which I'm very grateful for, because it does seem to help quite a bit. But her holistic dentist, I don't believe he does root canals. I don't believe he does any of these. He put down the drill forever ago. He doesn't do any of that. He doesn't like the fact. I mean, it's amazing that they're still allowing him to keep his dental license with the ways that he shifted. But his protocol and how he's helped so many people, and what I've been experimenting with, is this protocol of not brushing the teeth any longer, because our enamel is it's the body's way of protecting the teeth and keeping them from being allowing them to heal from the act of eating, but also to protect them from pathogenic bacteria, and allow it's not that all bacteria are bad, allow the beneficial flora to procreate and exist in a symbiotic way within our mouth. So his suggestion is to use an oral flosser, so a water flosser, instead of brushing. And in that mixture, you add a bit of vitamin C powder, which you can get. I don't like the manufactured ascorbic acid nonsense stuff, but to get just dehydrated cherries, you can find it online, of just vitamin C powder, natural fruit form. And you can find a powder version of that. So adding a little bit of that to the water, using that in your water pick, 2 to 3 times a day, doing that, and then follow that with a mixture of a little bit of coconut yogurt or some form of cultured yogurt, and then some diatomaceous earth and a little bit of green tea, and mix that all together into a paste. Put that in your mouth, swish it around, and then spit that out. It's a great way to hold it in for a few minutes or so. But that's a great way to introduce that beneficial bacteria and really help the mouth heal in a sort of more expedited fashion. And so he's seen many people, and he'll tell them, I don't even know if he sees people any longer, but when he was like, I don't even really want to see you until you've done this protocol for 6 months, because this is all that I'm going to tell you to do. And so until you've actually taken this step and started introducing this, then, that's all I'm going to tell you. So it works. He's helped many people. I've experimented with it for about 5 months now, and I have seen results. I have seen improvements in my mouth. My teeth seem happier, healthier. So I'm really enjoying that protocol as well. And then another one that I do is involving Oran therapy. As you guys know, I'm a huge proponent of that. So just swishing that in my mouth anytime that I consume it, anytime that I have it, is a great way to just help stabilize the mouth and give that beneficial fluid a chance to work through and work its magic in those areas as well. So those have been big game changers for me, as far as on top of cleansing my body from the inside out, which has never not been a focus for me. That's my primary, but having these supplemental ways has been really helpful to add another layer of coming at it from the other side. So yeah, just wanted to share some things that I've discovered and things that I've found beneficial, but I'm curious to hear, what sort of tools and tricks you found along the way.
Oh, got so many tools and tricks in my hat, especially with the teeth, because I have a long list. And just like many other things, it's not so black and white. So it really depends on what kind of issues a person is dealing with in their mouth, right? I mean, if it's a little plaque buildup or something, that's very different than somebody that is dealing with severe receding gums or bleeding gums or actual cavities, that they want to reverse. So we also want to know, like, what are the issues, and there are different things for different issues. In general, though, I would say, in terms, like, very simple, right? Let's start with some simple stuff. When it comes to keeping an alkaline environment in the mouth. So let's say you check your pH levels of your saliva, and it's consistently acidic. And what I recommend to do is check it first thing in the morning before you put anything in your mouth, and just to kind of get an evaluation. It's just like the first urine of the morning is going to contain different information than urine later in the day. Same thing applies to the saliva. So before anything has touched your mouth, to get the foundational level of what's going on. And then consume fruits. Let's say whenever you have your breakfast, juice or fruits, and then don't test the saliva right away. About 10 minutes later, test your saliva and just see what's going on. And if you're noticing that there's more of an acidic environment in your mouth at any point during the day, and especially in the morning, which I want to say here, just a side note, if you tend to sleep with your mouth open and you might not even know it, and that dries out your mouth And people actually might have teeth issues just because of that, not breathing properly. Mouth is open, the mouth gets dry, gets acidic, and there's a lot of tooth decay that happens during the night because of that. So that's another factor. And believe it or not, it's in some cases, and I've done it myself as well. It's like to tape your mouth during the night if you know that you have the tendency to open your mouth when you sleep. So yeah, that's just a side note. So if you notice that you have an acidic environment in your mouth, then simple thing is that you just baking soda, diluted with water, of course. So you just make a solution of baking soda and water, and you rinse your mouth. Doesn't need to be excessive, not like 6 times a day, but especially after you consume anything. Now, important to insert this, don't rinse it right away. So what happens is that, the body is very intelligent. After you consume something, the mouth starts to, with the saliva, start to replenish and actually build enamel. So I've done this mistake before I knew. I would, consume fruits or juice or whatever it may be, and then I'll rinse my mouth right away, immediately after I'm done. And that's not necessarily beneficial because now you're not letting your mouth to just do what it's supposed to do. So my advice or my recommendation is, after you consume something, is give yourself 10 to 15 minutes just for your mouth to do its thing without any interference. Even if it's only baking soda, but still, anytime we bring something external, it's not the body's own thing that it's doing. So give it 10 to 15 minutes, some say even 20 minutes, and then rinse it with baking soda. Yeah, so that's just a simple way to keep the mouth more alkaline. Now, there's a wonderful herb that is called comfrey. And comfrey is known for its abilities to heal bones, and that includes teeth. So if you are dealing with any kind of even cavities or weak teeth, comfrey is a magical herb. Now, comfrey can be taken in different ways. It can be taken internally, but again, I'm not recommending that because this is a case by case. Comfrey is a very powerful herb. People with liver issues, it's not a great idea to consume comfrey in high amounts. So you want to be smart about it. But you can drink comfrey root. There's a difference between the leaf and the roots. So comfrey root, drink the tea, and you can even make tea and swish that as a mouthwash. Comfrey, just comfrey root. The other way to use comfrey, and I've used it actually to help heal bones after an injury that I had last year, homeopathic. So I'm big on homeopathic remedies as well. And comfrey, which is in homeopathic remedies, is called Symph. Like you'll find it as the Sim. I don't remember the full name. I just say Symph. It's the Latin name of comfrey. And as homeopathic remedy, it's super helpful for any kind of teeth issues as well. And especially after procedures, like if you had an extraction, I highly recommend to implement homeopathic Symph comfrey for a period of time. And the comfrey root tea. And then you could also make a paste. So you buy a comfrey root powder and you can make a paste, just like Justin, you said, the paste that you make. You can even include the comfrey root or just use comfrey root, and you can apply that or even use that as a toothpaste, regardless if you're using an actual toothbrush or you just use your finger. You can just use your finger and rub the paste on your teeth and on your gums. Let it sit for 10 minutes or 20 minutes and then rinse it. Believe it or not, and this is another bursting the myth of sugar, that for your teeth, honey is actually raw honey. It needs to be very high quality raw honey, unprocessed, unfiltered, unheated, is an amazing antibacterial substance. It's well known. And you can actually use honey, applying honey, if there's an infected tooth, even apply honey onto the tooth. It's great for the gums. It's great for the teeth. What can I say? Honey is definitely, it can be very helpful if there's any infection going on in the tooth. Let me just pull up my list as well, because I've got some other, those are the main ones. And you mentioned, Justin, you mentioned the vitamin C. So you use the form of vitamin C that comes from fruit, which is the best kind, the cherries. But if you take just fresh strawberries, and you can rub the strawberries on your teeth and on your gums, that's a great way to get vitamin C directly onto the teeth and the gums. And you just rub the strawberries. You just cut the strawberry in half and then rub it on your teeth and on your gums and leave it for 20, 30 minutes and then rinse it with water. The other thing that is extremely beneficial for teeth is parsley. Is a magic herb in my book. So parsley, there's different ways to use parsley. Number one, of course, internally, you just add it to juices, or make straight up just parsley shots with some lemon. You could, and this is also very strengthening for the teeth. And I actually give that also as a recommendation during a salted vacation for people that miss the chewing. You take parsley stems, the stems, not the leaf, because the leaf there's not much to chew there. Take the stems, and the juicier the stems are, the better. And you just chew on the stems. You don't swallow it. You just chew. You kind of get all the juices out of the stems, and then you spit it out. And truly, it's one of the greatest ways to strengthen the teeth, is just chewing on parsley stems outside of a salted vacation. And then the other thing that you can do is actually make parsley juice. And if you do this, then you don't mix lemon. You just need to do like straight up parsley juice. And you rub that on your mouth, on your gums and on your teeth. You can swish it, or you can literally just rub it. Same thing applies to like barley grass juice powder, or alfalfa is even better. So alfalfa juice powder. You can do it with alfalfa powder as well, but the alfalfa juice powder is more concentrated because it's the juice of the alfalfa. And same thing, you can just make a paste and rub that on your teeth. So all those high chlorophyll substances are extremely beneficial to strengthen the teeth and build the teeth because of their high concentration of minerals.
Yeah, that's great.
Mm-hmm. Yeah.
Thanks for that. I'll add one that I just remembered when in regards to the specific tooth infection. If you have a really acute thing that you want to address quickly, one thing that is quite effective that's been shared before. This was another thing that Lila brought to the table, but using MMS or chlorine dioxide solution and augmenting that with DMSO can really have that targeted cleansing effect to address infection quite quickly. And you can search on Telegram. There are several groups where you can find an insane amount of testimonials of people who have used this to address all sorts of things, but particularly in the mouth, it can be very effective without going the conventional route of, whatever a dentist would prescribe that is using these old sort of methods. So that's not something I'll get into a whole lot of detail around, but that's something people can look into to find that, to get to use that as an effective tool to address acute issues with infections in the mouth. So that's very helpful as well. And then another one that Noah just introduced me to yesterday, and I went online last night and was kind of looking for some testimonials of people doing this, but using banana peels is a great way to mineralize the teeth, but also to whiten them as well. So that substance in the banana peel on the white side of it, not the yellow side, you can either scrape that out and make a paste and put that on your teeth, or you can just put the banana peel directly on your teeth and hold that in there for really however long you want to. But, you know, in a good length of time, a few minutes at least. And, that will help bring in some of those, the potassium, the magnesium, and other beneficial minerals that are in the banana peel, and help to strengthen, mineralize, and whiten the teeth in that way too. So that's one that I'm going to be experimenting with and trying out, and I'll report back. But yeah, just wanted to add those.
Awesome. Yeah, report back. And I'm so happy that you brought up the whole infection thing. So I want to touch on that in just a moment. That same thing, you know, with dentistry, and they just prescribe you a ton of antibiotics and after surgeries and all of that. And there's a way to avoid that. So same thing applies to tooth infections. So I'll just add a couple of things to the list before the infection part is, and that this can help also with infection and to whiten the teeth as well, is hydrogen peroxide. So that's something that I use. Same thing, diluted in water, 3% food grade hydrogen peroxide, very diluted, and I just use that as a mouthwash. It's not something to use all the time, but you can use it for a few weeks and then take a few weeks off and then use it again. But definitely if there's an infection, then hydrogen peroxide can be very helpful. And there was one more thing that, the oil pulling, because I know people ask, well, so I can only speak from my experience, and I've only had great experiences with oil pulling. And I use coconut oil. Some say, you know, sesame oil. I've used different blends also that has coconut oil and sesame oil together. And the other thing that I highly, 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 highly recommend is ozonated oil, actually. It's oil that is already infused with ozone. And that is hands down one of the best ways to help the teeth if there's infection, existing infection, and even healing after procedures. Ozone is great for helping the mouth and whatever is going on that needs more of that oxygen. But again, we need the oxygen from within, and that's what's going to help all the other stuff. But in the meantime, the ozonated oil has done wonders for me. And I'm really grateful for that. But the oil pulling, that's something I do recommend, because again, I've had my own experience with it, and it's a case by case, I guess, and people need to experiment. And if you find yourself that it's not working for you, then don't use it. And it might be, well, I would say it's not even might. It's a tool to use, and not for the rest of our lives. Like once we get to a certain level of health and regeneration, then we don't need any of those tricks, I guess, you know. But if you have any existing issues that you are wanting to take care of, if it's cavities or infection, and you want to avoid a procedure, a dental procedure, then it's definitely doable just at home. You know, with some research, with some investing in some ingredients or some products that already have those things made up, and you don't need to buy different things and put it all together. That's totally up to you. And you can do it at home. You can totally do it at home with just a little bit of effort. So going back to the infection part, that if you have an infected tooth, without getting into like, well, why is there an infection in the first place? Or what to do about it. I'm not familiar with the things that you've mentioned. What I have done, both when I had infected teeth in the past and then after procedures, and I've had major procedures, as I said, not just one time, and especially the recent one, which was the most extensive one I've had. And, you know, the dentist, although holistic, he said, you got to take antibiotics after this. And I'm like, thanks, but I'm good. And, you know, full of doubts. But of course, I didn't take antibiotics because the body knows what to do. And the antibiotics actually is just going to halt the healing process, and it comes with a price. So what I use for natural antibiotics is oregano oil. Is at the top of the list for me. Although I don't do garlic, my body just cannot tolerate it. I did juice some garlic. My body was actually telling me to do so. So for a couple of days, a few weeks after the procedure, actually, it wasn't even immediately after, I just added half a clove of garlic to a green juice. And garlic is medicine. It is an antibiotic. That's why it was never meant to be a culinary staple. It's antibiotics, nature's antibiotics. And so garlic, if you can tolerate it, oregano oil, golden seal, and you can just get it in tincture form. It's really bitter, but it's super effective. And then echinacea. So with those things, and colloidal silver, that's another thing. And with those things, you golden, like no matter how extensive of a procedure you do, if you just go straight into a fast, and it doesn't need to be just nothing, you could do only juices or some green juices, but post procedure after 24 hours is always like just fast on water, and then just implement all those natural remedies. But I do want to, there's a caveat on this one, and that's why, again, it's a case by case, that somebody like me can go and do such an extensive procedure, dental procedure, and not take antibiotic. But if you are still consuming cooked food and your body is very dehydrated and you haven't cleansed enough to a degree, and you're still consuming on a daily basis all those things, and you go into an extensive dental procedure, I'm not necessarily going to tell you like don't take antibiotics. So we gotta look at the individual, and that's why I always recommend, like, if you want to avoid antibiotics post procedure, and you living a lifestyle that is still acidic and mucus forming for your body, then I suggest you, just like you prepare for a fast or a juice cleanse, I suggest that before procedure, you prepare yourself. If you know that, okay, this is the day of my appointment, give yourself a month if you can, but at least 2 weeks, you start cleaning house. That you come into the procedure in a better state. So post procedure, number one, your body is that much more equipped to heal, and you could avoid the antibiotics because your immune system, your lymphatic system is just more efficient, and you can heal without the use of antibiotics and just boosting with those different herbs that I mentioned. And then, doing things in the mouth that help the healing process. But at the end of the day, less is more. The less we interfere and interrupt the process, the better.
Yeah, great stuff. And it is important to stress the fact that these are tools to use specifically to address something, and then to set down as soon as we have met that need. Because even the healthier, more natural forms of antibiotics, coconut oil is a natural antibiotic, garlic is a natural antibiotic, oregano oil, a natural antibiotic, it's still dysregulating the natural symbiosis within the body. So we might be mitigating some larger issue for a time, which can be helpful. And that's when we use that tool for that specific reason. But we also have to recognize that this is also introducing some dysregulation to the whole holistic part of my mouth. So when it is time to let go of that, then we let that go, so that our mouth can truly balance out in the ways that it needs to. So yeah, important to just stress that part. With all of these tools mentioned, we kind of have to be our own scientist and doctor and experimenter to find the best tools to use at the time, and to intuitively go with what we feel called to at any given moment. And also recognize that to just pile everything on all at once and do that till the end of time is not going to be the way. We're going to introduce more dependencies and complications later down the road if we start to introduce that kind of stuff. So take all of this with care, and of course, speaking and going over something in a more case by case basis is certainly an easier way to go and determine what might be the best tool for you. So yeah, just wanted to mention that as well. And yeah, I didn't know if you maybe want to move to questions from people here listening. Are you ready for that?
Yeah, we'll open it to question. I just want to add, and I'm happy you mentioned this, and then we'll open to questions. That it's not, none of what I'm mentioning here is to be used as an ongoing thing. Absolutely not, especially oregano oil. And as I said, like garlic was never meant to be a culinary staple. So yeah, that's a very important note. And with that, I also want to add, and this is something that I used to do regularly, is I would add essential oils to my mouthwash. And I still use some essential oils, but a lot less, and particular ones that I've actually omitted altogether. Because just like we have microbiome in the gut, we have microbiome in the mouth, which can go back to the same as I started. When the microbiome in the gut is messed up, there's going to be a messed up microbiome in the mouth, and that's going to create issues, dental issues. So what I've learned with, and you see, this is again with when we don't know and we still believe, because it's holistic, it's like healthy, right? Like everybody talks about essential oils, and instead of using the crappy conventional commercialized mouthwash, then people make their own at home with essential oils, and they put essential oils in toothpaste, like natural toothpaste and whatnot. And I just, recently learned that that's not necessarily beneficial, because it does interfere with the natural microbiome of the mouth and the pH. And that made a lot of sense to me, because those essential oils are very, very concentrated, extremely concentrated. So number one, when we buy toothpaste and mouthwash that, they're natural, but we don't know the recipe. We don't know how much of the essential oils they put in that toothpaste or in that mouthwash, right? They just write down this essential oil, but we just don't know. When we make it ourselves, we have obviously more control. But just understanding that those things are not necessarily beneficial. So especially things that there are some essential oils that are more extreme than others when it comes to how it affects the mouth, that are well known, like oregano oil, for example, like clove oil. Clove oil is amazing for infections, or if you have any toothache or anything like that. But to use it on a regular basis, a mouthwash can really disturb the microbiome in the mouth and the natural environment, and then affect the saliva in the long run. And, for me, it was like, kind of like, oh, clove oil. Everybody talks about it, how it's great for dental oral care. Yeah, well, there's some gray areas between the black and the white. Same thing applies to eucalyptus oil. If you use it, and I love eucalyptus oil, but now if I use it, it's like one drop and I dilute it with a lot of water. And the ones that are a little bit less harsh would be the spearmint or peppermint and lemon essential oils that I mix, a drop of either or. So now I don't make like a blend of 5 different essential oils and all those like really harsh ones in my mouthwash like I used to do. I'll just keep it very simple, with the baking soda or the hydrogen peroxide, and I'll add a drop or 2 of lemon essential oil, or eucalyptus, not both. So I just wanted to say that about the essential oils, because I know, like myself, many people that are looking for the natural route, and they use those essential oils on a natural basis, on a regular basis, but in the long run, that can actually create quite a bit of dysregulation and imbalances in the mouth.
Yes, very well said, and great stuff to mention for sure. So we'll move to any questions that might have come up during the conversation, or stuff that you've brought to the table, and let's just keep it on topic. So related to oral health and anything that we've discussed today, or just anything teeth related in general, mouth related in general. So if anyone has any questions or things that they want to bring forward, I do have a few written questions that we can get to, but I love to prioritize people who are actually here live listening on the show. So if you do have any, feel free to raise your hand and we will do our best to get to you. All right. Well, let's just jump to some written questions. So one was, let's see. I think we've kind of addressed this already, but this was from All You Cat, and they said, of interest to old listeners here, old missing teeth, implants, and bridge work. Would you address connection to aging? Thanks. So yeah, in general, we've been so warped on this idea of aging that we all have to age, and it needs to look, it's going to look a certain way, and it's just going to suck, and you just have to deal with it, and then you're going to die, and that's it, which is a complete lie. Aging is just a result of toxin accumulation from layering and layering and layering upon oneself to where the body just can't handle its normal regenerative abilities. So we've really got to let go of this idea of aging, and step back into that. It's all just signs and symptoms that we are not addressing something in our life. We are allowing some form of toxin, whether this is including mentally and spiritually, but physically, we're letting some toxin into our sphere, and it is adding to the point to where our body just can't handle it. So then we have the appearance of aging. So in that regards, I feel like we addressed it pretty well, but I don't know if you had anything else to mention in regards to missing teeth, implants, and bridge work, besides what we've already discussed.
Yeah. Well, well said. You know what you said, Justin, about the aging, that's a myth, and teeth deterioration, just like eyesight or anything else, has nothing to do with age. It's, yeah, the body is just declining because of the environment. However, though, you know, just like in my case, right, and I'm not even in what is considered to be old, you know, whatever that is. I've got like so many missing teeth because, as I said, when your mouth has been butchered because you didn't know, now there's, okay, then what do we do, right? It's like the reconstruction, restoration, and there are options, right? So when it comes to, and people ask me this quite often, and it's a very individual choice. That's all I can say. You know, it's like you got to do your own research and the different alternatives out there when it comes to implants, dentures, bridges, and things like that. But I have a few things to say about this whole topic. Number one, always find a holistic dentist to work with. Always, 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 always. Even if that means, because yeah, if you live in the U.S., holistic dentists, when it comes to cost, is no joke. It is no joke. And many of those holistic dentists actually don't work with insurance. So it's sad that that's the case, that for whatever reason, your holistic dentistry you need to be kind of like a millionaire in the US. But there's other clinics in different parts of the world. And so that's my recommendation as a starting base. If you know that you've got some reconstruction, restoration work to be done in your mouth, that it's beyond just oil pulling and rubbing strawberries on your gums, then find a holistic dentist to work with. It's worth your energy, it's worth your in-search, it's worth everything. Then when it comes to implants, actually, let me start with bridges. The thing to understand about a bridge is that in order to put a bridge in, a dentist needs to compromise other teeth. So it might be a good solution in the sense that it's not as invasive as like an implant, right? That you actually go in and put something in your mouth and your gum, but you have healthy teeth that are going to be compromised in order to get the bridge in. So to me, when I learned that, I'm like, no, thanks. No, because the few teeth that you do have left, God bless them, you know, don't touch them. Don't drill on them. Don't slice them. Don't do anything to compromise the integrity and the health of the tooth and the strength of the tooth. So I'm not a huge supporter of bridges because of that. Then you have the dentures, like somebody that doesn't want something really invasive, and it's a piece, you know, that you can take in and out. And that is an option, no doubt. However, like I mentioned earlier, there's something to be said and to consider that missing teeth in the long run are going to have consequences on your entire mouth, and then not just your mouth, but your jaw, your neck, your spine, your hips. It's connected to the skeleton system altogether. And it does. The teeth will shift and move that may affect other things. So missing teeth is, it's something to know that it can come with other consequences. And then the implants, again, it's an individual choice. I chose to put implants not in all the teeth. I still have some missing ones in the back. But if you do implants, certainly don't do metals, don't do titanium, but opt for the zirconia material that is that much more compatible with the body. And now here's the thing, for people that have compromised teeth and have implants in their mouth, you need to be on top of it. You just can't afford, living like on just regular food, whatever it is, because your mouth is a place to consider, because you've got those implants and things that can get compromised if your lifestyle is not healthy and not alkaline. So that's just another thing to consider, that if you get implants, if you have titanium implants and you have an acidic mouth, that is bad news. Like, you're definitely going to have like rusting metal in your gums at some point, and that's going to create havoc. So just also factor that in, that if you choose to have implants, regardless if it's zirconia and titanium, and my recommendation is definitely zirconia, your lifestyle needs to support the choices of having implants, because it's not a regular tooth, and issues can come up if your lifestyle is more on the acidic mucus forming side.
Yeah, great stuff. It's all case by case. We kind of have to weigh our options and see what is best for us in a new particular moment, and lean into that internal guidance. Thanks for that. And the other questions that I've gotten, I think we've addressed pretty thoroughly. I mean, just concerning oil pulling, so Roxy asked about that. So just to give the concerns with oil pulling that I've heard, I haven't directly experienced this myself, but I've never done oil pulling for a long period of time. But just as the talk of this, using an antibiotic in that sense, if we're doing that consistently, we are going to be disrupting the natural flora within the microbiome within the mouth. And supposedly the oil does soften the enamel, so it just leaves it more susceptible to damage later on. So I do think it's helpful and from an Ayurvedic sense, Lila shared that it is helpful. It can be helpful for a short period of time, but just a long period of time, it might not be ideal to use that. But you've got to be, your own judge on how to go about and what to do with that. I've seen people have great results with it. But I'm hesitant to use that in a longer term basis, just for those reasons.
Well, and I agree with that all of those tools, that if we think about it, would we actually, if you were living right according to nature in a natural state, would we use that? Where would we even find coconut oil, right? So it's always things that I think about and consider when I'm being asked those questions. So it's a tool, just like most of the things that we are talking about here, those are tools. And I also want to say that even from Ayurvedic perspective, and why they recommend oil pulling beyond just teeth, right? It is said that it helps to pull out toxins. But as I said earlier, the mouth is merely just the opening to the GI tract, right? So it helps to maybe even draw and cleanse some toxic material in the GI tract altogether. But we go back to the same foundational understanding. So if you don't have a toxic, filthy GI tract and the body is alkaline, we don't need any of these tricks. And truly, I can tell you, and I use coconut oil pooling, but I do I do take breaks. So I'll do a few days without doing it. And when I'm in fasting mode or non-consumption, or when I don't do I don't want anything in my mouth. And I can tell you that the times that my mouth feels the best and really like just clean without me putting anything is just dry fasting. My mouth feels it the best, and I can feel that my teeth are clean. Just by like feeling it with my tongue without introducing anything in my mouth. So yes, we agree that our natural state, when we are in that natural state, we don't need any of those things. And on the road to that natural state, then we employ some of those tools, which we each need to find the tools that work for us in any given moment. And the only way to do so is by our own experimentation.
Yep. Agreed completely. Yeah. So, that's all the offline questions that I had. Did you have any additional ones, or no? Was there anybody? Oh, there we go. We got a few people who got questions. So we'll start with Roseanne, and then we'll move to Daughter of the Most High. So go ahead, Roseanne.
Thank you, Noah and Justin. This has been so informative. I'm so glad it's recorded. So like you, Noah, I had a lot of teeth issues growing up. I had a really large overbite, as a young kid, which I had a not fully formed mouth. So it's not that surprising that, I could have an overbite. And so they took out my 4 eye teeth and put braces on me. And then after that, of course, it was a slew of, while I had my braces on, I had a slew of cavities, quote unquote cavities. And of course, then that leads to a ton of mercury. And after, as an adult, this was about 20 years ago, I had quote unquote really good insurance. So I got all my mercury out and put composite in, which I thought I was doing a good thing. But then I don't remember the dentist or me ever being, masked or, protected in any way. So she was kind of, she was, it might have been longer than 20 years. Anyways, she seemed a little bit ahead of her time, but obviously not informed that mercury was going all over the place. And then luckily, I've never actually had a root canal, but I do have about 3 or 4 crowns. So because of all the, the dental work I had as a kid, they obviously became, loose and all this stuff. So anyway, so my question is, if you know anything about the ramifications of losing 4 eye teeth at 14 years old, and B, I have a patch of psoriasis / eczema, just giving you a visual of what it might be on the back of my neck, and it goes up all into my head. I can't see it obviously under my hair, but I can feel that it's itchy. And I was just curious if you had thought, if you think that could have anything to do with the teeth issue, or, anything, or could that be, is it probably something else? So thanks so much.
Roseanne, and just to clarify, so you don't have any metal left in your mouth, or you still have? What is the crowns are made of? The crowns that you have?
So they redid all my crowns except for one was bothering me, and so they redid it, and I could see it. One looks like it does have some metal on it, or mercury or something. So I'm not sure. I think all the other ones are composite, because like I said, I got them all over the years. I got them redone. Mm-hmm. So I think I have minimal, but I could have some left in my mouth.
Well, that will be the first place that I would look into. that if there is any remnants whatsoever of metal in your mouth, to consider replacing that, because that can cause a lot of issues. You know, I can say for a fact that that is a contributing factor to the psoriasis that you're experiencing in the back of your neck. But it could be because, as I mentioned earlier, you know, regarding lymphatic stagnation, if you have teeth issues that you know you've got things going on in the head area, and so if there's any metal and any toxicity that is basically trying to find its way out, and the elimination channels are not open enough to accommodate that, then you're going to encounter skin issues. So if the kidneys are not open enough and the GI tract is not clean enough to, again, pull out that toxicity, and the skin is not open enough, then the skin is where you're going to see the toxicity coming out from. So it could be, again, I can't say. The only way to know that is if you actually replace or get rid of that metal that is still in your mouth and see what happens.
Okay, yeah, that makes sense. And to clarify too, I haven't had like any kind of skin conditions over my lifetime. This just started about 10 years ago, and then it kind of through my detoxing. So I guess I've been in the process of detoxing for about 5 years, 5-6 years, you know, taking it step by step. And so it kind of sometimes it gets worse, sometimes it gets better. Sometimes I think it's going away, and then it'll, you know, flare up. So yeah, that's a great input on checking out and to see if you know, I hate to mess with my teeth because I don't have any, like I never have any pain or anything, and you know, they seem to be okay. But yeah, I think that's probably a smart move to go and see. I do know a more holistic dentist here. I don't know really how great she is, but I know she's better than most of the dentists. So yeah, I'll check that out. Thank you so much.
Yeah, for sure. It would be a minor thing if you do need to address that tooth. So at least, you know, it's not an invasive procedure or anything major that needs to be done. You would need to just replace the crown, and then I would recommend potentially doing some heavy metal protocol, you know, for a little while. Just something to consider.
Okay, thank you. And then ramifications to having 4 eye teeth pulled at like 14 years old.
Oh, well, again, I'm not like an expert when it comes to that, but just like I said about any missing teeth, I'm sure there's some implications, more on the structural form of your jaw, your mouth, your body. Do you experience any tension in your neck, any tension in your hips, any tension in your jaw? Is there anything like that?
Not too bad. I honestly, when I gave up dairy, so it was like, I think meat and dairy were around the same time I gave up. That really helped clear up a lot of any sinus issues I had, because I always felt like I was plugged, and you know, and this holistic dentist said I needed this $10,000 procedure to like widen my mouth because of the fact that I took out those teeth, which probably could have been accurate. I don't know, but it seemed like yeah, a lot of the issues cleared up when I did give up the acidic food. So yeah, and that's been about between 2 and 4 years now.
Great. Yeah. So there's the teeth are out, you know, there's nothing we can do about that. You could consider placing implants, but that's really your choice. And yeah, I don't know what else to say about that. But when it comes to the whitening of your mouth, have you heard about mewing? You know what mewing is?
No, I've never heard that.
Okay, so maybe this will be a good time just to post it in the group. Mewing, I don't want to get into all of it right now, but it's a dentist that same thing. He's revolutionizing the industry when it comes to orthodontics. How do you say it? He speaks so much against braces and all these things, and offering very natural ways to straighten and widen the mouth. And he came up with this method that is called mewing, but it's basically just positioning of the tongue in a certain way against the upper palate in order to bring the jaw back to its normal size and normal width, which you would say. And it also helps with the airways to come back to their natural state. So we can post more information about mewing, what it is, how to do it, how to start practicing it. It really is that simple. It's just a way to position your tongue, but it does require awareness and actually start thinking about it and noticing where your tongue is resting during the day. And he also speaks a lot about during sleep and sleeping with the mouth open and how to take care of that.
Well, that's fascinating, because that sounds exactly like what she was going to say, or what she was going to do with a, like some sort of a technology kind of a mouthpiece and stuff like that. So yeah, I will definitely look into that. And yeah, the gaps were closed with braces, and of course that's a whole nother issue. But yeah, I mean, thank God I have straight teeth, so no implants. I'm not going to put that on my to-do list, but I really, really appreciate your all your information and all everything you've helped us here with today. I'm going to definitely re-listen to this. So thanks again.
Yeah, thanks, Roseanne, and thanks, Noah. It is I just shared the several different mewing videos on JC Family. Those are ones that I posted on through the Eye of JC channel, which is just a channel I started recently to share interesting things that I come across. But I forward those there to JC Family so you can see them at the bottom. Yeah, it's a great thing to keep in mind, and really makes a lot of sense why we have shifted into this sort of mouth breathing, mouth, and I don't even really want to get into this because it could be a whole show, but just the barbaric way that wisdom teeth are stolen from us, and we're taught that we're not supposed to have them, even though they're called wisdom teeth for a reason, because they help our mouth to grow and lengthen so that our breathing and our tongue placement, our mouth structure can all form in a way so that we receive more wisdom by breathing better. But of course they don't want this, and they come up with this bullshit idea that our mouth is not made for that, and somehow God made a mistake, which is it's just nonsense. So yeah, that's a whole nother thing to get into, but just wanted to mention that. And yeah, in regards to the removing metal out of the mouth, a lot of people have mercury amalgams and things of that nature. There's several schools of thought on that. Some people suggest that if it's not causing any immediate issues, to not even touch those things, because the act of removing them can introduce a whole lot more issues. So we do have to be careful that if we do decide to get those removed, that you're going about it as carefully as possible, both on the front end and the back end. So the front end would be checking to make sure that whoever is doing that procedure is at least SMART certified, which stands for Safe Mercury Amalgam Removal Technique. So they're certified in this technique of setting up a device to make sure that as best as possible, none of the mercury bits or fumes or anything go anywhere near the rest of your body. This is not perfect. This is not something, and depending on the level of care that somebody's using while doing this practice can make a big difference as well. So there is some risk involved, but that's the best thing that we can do on the front end of getting those out of our mouth. And I've gone through that procedure. And then on the back end, as Noah mentioned, having some really specific focus on heavy metal removal, which is great to do anyway. but to certainly target that during that time of using herbs to sort of help stimulate and move these heavy metals out of the body during that time. Fasting as well. Fasting is a great way to cleanse the body after any procedure, but certainly after a procedure like that. So something to consider, because it is quite harmful if we get that into the rest of our body. So we just have to take that with great care in that regard. So just wanted to mention that. And yeah, I think we'll pass it off. We got time for maybe you got time for one more question, Noah?
Mm-hmm.
Okay.
Yeah.
We'll end with Daughter of the Most High. Go ahead, sister.
Hi, Justin. It's Rachel. How are you, sweetheart?
Hey, Rachel. Good to hear from you. I'm well. How about yourself?
I'm well. What a great show. Thank you so much. Couple of things, okay? I have a couple of questions. You had because I'm new at this, because I'm still eating, because of my weight loss, I still have to eat carbs, so I can't do everything right now, but I can start with, you said dried cherries or diatomaceous earth and green tea. Was there another ingredient to start brushing your teeth? Was there an ingredient that I was missing?
So what I'm going to do is I'm going to forward the protocol that Lila shared quite a while ago, and her voice explanation of it as well, because she does a much better job than I could, and it will list the ingredients and everything.
And
there.
what
So
channel? What channel?
On JC Family. I'll put that at the bottom of JC Family chat.
Okay. Okay. And then also I wanted to know, I do have some a lot of gut issues I had H. pylori, I have GERD, and then I have some mouth problems in my teeth. My parents both had them really badly. I'm here at the health food store, so I wanted really to talk to you about, both of you, about Comfrey. There's a tincture, and then there's a cream, and one's like, I'm not sure which one to get on that. Can you go over that as far as Comfrey and put it on your gums? Because I have receding gums and bleeding gums. I have gingivitis. So if you can speak on that. Do I have to shut my microphone off when you're talking, Justin?
it is helpful if you mute the microphone.
Okay. I'm going to go ahead and mute. And let me just say a couple of things. I wanted to know about that. Okay, I'll get that on your channel. And I have done oil pulling with the coconut oil. And I just wanted to know about the Comfrey and the paste. Should I do the tincture or should I do the paste on that? And then I'll have another question. Thank you.
Well, for the Comfrey, it's not so much for receding gums. I don't know, it could help. I can't see a reason why not, because it helps connective tissues all around. It's more for bones, so it would be more for strengthening teeth. Receding gums, bleeding gums, a little bit different, but you could try. The tincture, I would only guess that what you're seeing at the health food store is for something to take internally. So that's not something I'm going to recommend without knowing anything about your health history. The cream, Comfrey cream, is usually for topical applications when you do have any kind of bruising, broken bones, fractured bones, or anything like that. So if anything, then you want to get the Comfrey root powder, and then you make a paste of that, and you can apply that directly on your teeth or on your gums. Now, there's a toothpaste powder out there that is called, it's Christopher's, I don't remember, I think it's just Christopher's. And he has a wonderful blend that actually has the Comfrey root, it has white oak bark. Dr. Morse also has a phenomenal toothpaste powder. And there's another, there's something that I use myself. It's specifically for receding gums. It's an amazing medicinal oil that is infused with Ayurvedic and Chinese herbs, and it's something that I've been using now for the last couple of months, and it has done nothing but wonders. just the way my gums feel. It's absolutely amazing. So I could share those things on Justin's channel if you want to look into it. But those are the things that I would recommend. But when it comes to the tincture or the cream, that doesn't necessarily apply to what you have going on in your mouth.
Okay, thank you. I got it straight now. I do have a implant, and I have several root canals, and I don't have the funds right now because I know these holistic dentists are very, very expensive. I've already called them, and they're just a lot of hundreds and hundreds and hundreds of dollars. So I will do it in due time, when we get, further on. So I wanted to tell you about, I have an implant, and I have a tooth all of a sudden that has a little hole in the back on my bottom tooth. All of a sudden I was eating, there's a hole in it. So I don't know, do I have to go to a holistic dentist for that? Because that's going to be a little different. If you can just speak on that. Thank you.
Yeah, it's just what I recommend. I don't recommend conventional medicine unless it's a extremely advanced in their thinking, kind of a doctor or dentist. But that's my recommendation, is to always seek for a holistic dentist that have a deeper understanding of the connection of the teeth and the body, plus the materials that they use are somewhat less harmful for the body.
Okay, I was just, and I'm also, thank you for all your information, and you and Justin. And I'm doing zeolite for detoxing. I've been doing that for a while. Is that in parsley? I'm not parsley. Almost the
Cilantro.
What's this? Yeah, cilantro. Yeah. Can you speak on that? And that would be it for me. Thank you so much, Justin. I love you, and I love the show. Thank you.
Yeah. So, yeah, zeolite and cilantro are definitely notorious for heavy metals and to pull those heavy metals out. But here's the thing, and this is where a lot of people kind of find themselves banging the head against the wall, is that you introduce these heavy agents that have the ability to pull. But if the elimination channels are not open, then where does it all go? It can actually, in some way, shape, or form, cause more harm than good. So it's always like the foundation is we got to clean the terrain and then introduce those agents as a way to help and perhaps expedite, not that we need to expedite anything, but just to help pull something that might be lodged deeply in the body. But to do that, just using the cilantro, using the chlorella, using the zeolite and all those things, it needs to be in conjunction with a cleansing protocol that is actually supporting the opening of the elimination channels and also supporting the elimination organs, the kidneys in particular. So that would be my 2 cents on that.
Okay. How do you open the pathways? I know MMS channel, they speak a lot on opening up the pathways of the lymphatic system, the kidneys and the liver and all that stuff before you start the MMS to clean out the pathways so the MMS will work. So that's what you're speaking about. Do you have any recommendations besides the MMS?
Hey, Rachel, since this is veering a little bit off the oral health, I'd suggest that you go back and listen to the show that we did on cleansing the GI tract. So colon health, that's going to be your main pathway of elimination, and one of the first ones to address. So that will really address in that area. And it's really a holistic, it's comprehensive. It's not always just one thing to do. It kind of depends on what else you are doing and just sort of chipping away at this larger issue of where we've gotten ourselves. So it's all the things that we talk about of just cleaning up the diet, moving into more hydrating, cleansing, and fasting. So these are going to be the ways to expedite and move through that process. But yeah, let's keep the topic here on the oral health. So I appreciate that. And I did want to mention in regards to brushing. So we haven't really talked about that. So, and I mentioned how I'm not brushing any longer just because I feel like it is more destructive to the enamel. And I will say that if you are still engaging in brushing, if you're still doing that, make sure that whatever brush you're using is like softer than the ones that you can buy in any store. So like specially ordered, or going to a health food store that's going to carry something that's extremely soft. And even when you're using those, like extreme care with how you're using that. So one thing when I was still using a toothbrush to avoid me using too much pressure is I would only hold it with these three, with my thumb and two fingers. So I wouldn't even use my full hand, because even that, you just get back into that pattern of sort of grinding away at that enamel. I still think that even holding it gently like that can still lead to enamel damage, but you're definitely going to be doing a lot less and just having that gentle cleansing. Another method of cleansing the teeth without as much abrasion to it is using a gentle, like organic cotton washcloth, something that really soft to where you can just wipe away the residue off the surface of the teeth without really grinding in and destroying the enamel. So that's something I wanted to mention as well, in regards to our teeth health. So yeah. And I'll go ahead.
Just to add to that, and I agree with Justin, definitely soft bristles if you get a toothbrush. I still brush because I just enjoy it. But it is true, just don't put pressure. And the other thing that you can do is just use your finger. You can, if you do have a tooth powder, which you want to dump all the toothpaste, by the way, like anything that has glycerin is very destructive to the teeth, and it does affect the regeneration of enamel. So glycerin is not good news for your teeth. So I always recommend to either get a tooth powder that doesn't have glycerin, because a lot of the natural toothpaste have glycerin in it. So, but if you get an actual paste that is not in powdered form, there are some pastes now that they don't have the glycerin in it. It's just coconut oil, and then a bunch of herbs and whatnot. So you can that's what I do. I have this one paste in particular. I just take my finger and I just rub it on my teeth, and I just use my finger. And that feels great as well. And then I'll just use a soft brush when I feel like it, and kind of very gently go do a second round of that.
Awesome. Yeah. Hey, Lila, go ahead.
Hey guys, thanks for this talk. It's really great to hear everybody talking about these things. And I just wanted to speak quickly to the daughter of the Most High regarding the hole in the tooth. Just firstly, I'd really look at what tooth that is and what it's connected to. And then also, when I asked my dentist about this, he said, what one would do would be to trust the protocol and that the tooth is regenerating, and take a special care in painting the tooth, maybe get a culinary brush or something like that, and really focus on treating that specific tooth more than you're treating the rest of the mouth. So paint the diatomaceous earth and yogurt and green tea on more than you're doing it in the rest of the mouth. And then if it depending on the size of the tooth, the hole in the tooth, you might just get a little bit of dental wax and apply that dental wax to keep food from going into it as it's regenerating from the inside to the out. So that would be a way of dealing with anybody who's got a large space where food's going to be getting caught, etc. That would be what he would recommend, and just use that dental wax for a period of months as the tooth hole is regenerating, and it will eventually fill itself in. But it does make sense to kind of protect that from random stuff getting caught in there and then creating some type of issue. And just briefly, you're at the health food store, look into dry brushing. I feel like that's the biggest thing that somebody can start doing as far as their lymphatic passageways. The skin is the largest organ as far as detoxification. And if you're dry brushing maybe 2 to 4 times a day, even right now, I bet that would really help. So highly recommend it. It's just a regular bristle brush that you might use in a shower or whatever, but you don't get it wet. And if you go online, or I'll just go on JC Family and post something about dry brushing. But maybe that's something that you can start right away. Thanks, guys.
Okay, where would I get the wax at for the mouth, Lila?
A dental wax, I probably would feel comfortable just getting some honeybee wax. They have that at a natural food store, or they like here at our, I don't know exactly where you're located, but at our farmers markets, they sell honeybee wax. So I might use that. You certainly can buy that, but I would look at what's in it, from a CVS or something like that.
Awesome. Thanks, Lila. I appreciate
Thank you. And then dry brushing means with your finger, right? Is that what dry brushing means? Without any?
No, there's actually there's brushes that you can find in most health stores that they just have sort of if you ask them for where their dry brushes are, they'll point you into, they'll know what you're talking about. But they usually have a long handle so you can reach areas on your back, and it's just something that you run across your whole body to sort of encourage that lymphatic stimulation, encourage that waste removal, and it feels great too.
Well, thank you. I'll do that. And also, what's her name? The lady from Australia. She also talks about the mini trampoline, just stepping on it, and it's cured so many diseases just by doing a small trampoline. She said, I just read that today. Thank you.
Yeah, rebounding is great too. It's a great way to move the body and move that lymphatic waste. So yeah, great suggestion there. Noah, you good on time? We got Tracy just jumped on. You good with her?
Yeah.
Awesome. Go ahead, Tracy. Welcome.
Hi there. Excellent talk, you guys. So yeah, I'm not going to go into my history or anything like that, but yeah, I've got a very messed up mouth, Noah, myself, but my situation was I wasn't taken to a dentist until I was 13 years old. So by the time I got there, my mouth was a mess because I was brought up on lots of candy. Anyway, so I have a pretty bad situation, but I've got a mouthful of mercury. But anyway, I haven't got any issues where I feel like I have a tooth broken away from so much. One particular tooth has broken away. It's a molar, and it's broken away from there's so much mercury put into like the hole. Anyway, I don't have any root canals, but so I wanted to get to the actually I just was going to say, like, I just really appreciate you sharing your experience. Very, very intense stuff, especially 9 teeth to be pulled that's huge. Could be so hugely overwhelming. I know that I'm going to have to get some pulled myself. Probably not that many, maybe only like 2 or 3. But thank you as well for mentioning about the not having to remove them. You shouldn't if you don't have to, kind of a thing. But I have about 13 fillings in my mouth, small and big. Anyway, so I will. I'm looking forward to dealing with it all. I didn't try the oil pulling. I tried a little bit. I made a paste a while ago. This was over a year ago, and I made a paste with baking soda and coconut oil and peppermint oil. Something I tried to experiment with for a short period of time, maybe a couple months or something like that. But I found it to be not so great. I just went to just baking soda. But yes, I know it's very abrasive, so I'm very careful, but mostly just rinse with it. So, so I look forward to learning more, of course, and any new technology that will be coming out in the future. So I'm not too worried, but it is a mess. My mouth is a mess. Front teeth I filed them as well, but they're shorter than they should be, so I'm missing a lot of length. Anyway, but I definitely have noticed I just want to comment really quickly. Justin's, yours definitely have noticed over the past few years. But most recently, like in the past 6 months, that your teeth are definitely noticeably whiter. So that's something that, just for an observation that I wanted to share. So what you're doing appears to be working really well for you, and that's really great. So Thank you for sharing your experience too. And then just one real quick comment about the dry brushing, is that, yeah, dry brushing is excellent. I use dry brushing head to toe, and you could, I just buy these like they're cleaning brushes. They have coconut husk brushes. They're not some special organic product you have to buy at some special store. I buy them from the hardware stores here. I give them a really good cleaning, but they're pretty organic. It's coconut husk, so it's not like not a plastic bristle. So that's pretty natural in itself. So you can kind of find those at like hardware stores. They're kind of sometimes stuff in the drugstore or health food store. Yes, they'll have excellent ones as well. But if you can't find something there, maybe you could look. Maybe I will take some photos. I'll take photos of mine and I'll share them on JC Family. Okay, just so I can give you an idea of what I use, and I use them specifically doing, like I said, whole body dry brushing. And so it's just like it sounds. Is you do it dry. You don't want have your skin wet, and you can feel as you start to do it. You start to really feel a good gripping with the brush and the skin is what you kind of want. It's a little bit, obviously it's going to be, feel odd at first because if you're new to it, but I've even used sand, like the beach. I'll even use sand, but I do very gently little circles in the skin, and then drawing the brush up in a long stroke. But I always do drawing upwards, drawing towards the blood flow is the way that I go. That's the technique I use. Some people say you can go down as well. You can go down a bit because the blood does go down the leg and back up. But it is really good for getting it to get moving up is to strictly brushing just up, drawing from the ankle and up the back of the leg and up the leg itself. And different type of brushes, of course, you can get smaller ones, bigger ones, depending on, the comfort of what you need. And like Justin said, well, maybe you want something with a long handle that you could reach on your back, but it feels amazing. And your skin texture can change so drastically within 24 hours of using the dry brushing. And over time, I mean, you can see like, the texture gets thicker and stronger, softer as well, like softer to touch. But there's a strength to it that it builds over time. It's a really awesome side effect or effect. I shouldn't say side effect, but it's a great effect as well as what it's doing internally. And so it's something you could really visually see as well once you start to get in the groove of it. So, yes, I'll share the photos of my brushes, but, yeah, I just wanted to share that. That's all for me. Thanks.
Awesome. Thanks, Tracy. Yeah, Lila shared another, little site explaining dry brushing and best practices. And, it's a great thing to get into. So yeah, I think we've gone on for a good length of time today, so probably start bringing this to a close. Noah, did you have anything you wanted to share just in closing to sort of wrap this up?
I think we covered quite a bit, so there's not much else to say in this now moment. Is just like any other topic, it always starts with the inner terrain and to educate oneself when it comes to teeth, not just go to the dentist and nod your head and yeah, sure, pull out my teeth or whatever, but yeah, do your research and educate yourself and take your time. Like if there is some decisions to make when it comes to your dental future, just take your time and know that many things, like I said earlier, many things can be done at home and that you can avoid different procedures if you're willing to put in the work and the diligence and the attention on your body and in your mouth as well.
Awesome. Well said. Yeah. No, not much else for me either. Just want to thank you, Noah, for joining me today in this discussion. Thank you, Lila, Roseanne, Rachel, Tracy, and everyone else who's spoken up today and joined in the conversation. Really appreciate y'all. And yeah, let's just keep experimenting. Let's keep sharing and comparing notes. Let's keep guiding each other home, getting back to that simplicity of where we don't have to be concerned about our teeth, because we're just eating what we're supposed to be eating, and living the way we're intended to live, and everything else works as it's supposed to. So we're getting back to that point. So yeah, just appreciate everyone. Sending love to all. And until next time, guys. Bye, everyone.